Hi, everybody. How would you like a step that you can take, a simple step where you can deal with sexual behavior disorder? Well, today we have a guest with us, Eric Belsterling, who is a specialist in this area. And what he's going to do is offer a three-step simple process to deal with compulsive sexual behavior and disorder. This is Eddie with the Mindful Emergence. And what we do as a Mindful Emergence is try to offer you simple steps that you can use to really find the quality of life that you want. So this video is going to be part of a playlist on our YouTube channel where we bring in guests who offer simple steps, expert guests like Eric is with us today. So we invite you to check out the other videos on that playlist. I really encourage you to put comments, questions, anything like that. And if there's anything for Eric, I'll pass it along to you and he can respond to you in the appropriate way. And of course, if you like the content, give us a thumbs up. And of course, we always like it when people subscribe. Make sure you hit that bell so you get a notification when videos come out. I do 2 a week on Mondays and Thursdays. So we are joined, as I mentioned, by Eric Belsterling, who has more than 25 years experience working in the mental health field to varying capacities, from being a behavioral health technician, a master wilderness guide, to the clinical director of a Level IV PRTF in North Carolina. Eric received his master's degree in 2006 from Naropa University in transpersonal counseling psychology with an emphasis in wilderness therapy. He's worked at SUS of the Carolinas, Four Circles Recovery Center, Alida Home, and has been the founder and owner of Heart and Soul Recovery, PLLC, since 2014. He specializes in all addictive disorders and/or co-occurring disorders, and has a very specific specialty in what he calls chronically problematic sexual behaviors. So quite a background, a lot of training, a lot of experience. What else should those watching this video know about you, Eric? And by the way,
Sure.
welcome and thank you for joining me.
Thank you, Eddie. Thank you for having me, and I'm honored to be here. So I'm a licensed clinical mental health counselor. I'm a licensed clinical addiction specialist. I'm a certified sex addiction therapist. I'm a certified multiple addictions therapist, and I'm also a certified clinical supervisor intern.
Hmm.
So just throwing that out there, that those degrees, not to add extra alphabet to my soup, but just I love to learn.
Yeah,
I'm
yeah.
constantly learning.
Well, I'm sure you've gotten tremendous training from very learned people, and that serves you well.
Yes.
And of course, I know you on a personal level, and I have for, I guess, 10 years or so. And one thing I know about you is you identify as a person in long-term recovery, as I do. And I'm just wondering if you could share briefly, what does that mean to you as a person and as a therapist?
Absolutely. First and foremost, I want people to know that I'm a wounded healer. Basically, I've been there. I've been in the dark nights of the soul, as I like to call them. And I think it's important that people. I want people to know that you can, and people can recover and live incredible lives, and overcome addiction and transform all their pain and suffering into meaning and connection and equanimity.
Hmm.
So that's my passion, and that's important. And I just want people to know that it's a great life.
Yeah.
Uh, yeah,
And you've been there. You understand. You have compassion and empathy for those who come into your office or you meet online and are
right.
struggling. Yeah. And of
Absolutely.
course, as you know, and I think those listeners who are familiar with Margaret and I know, that we really put a lot of emphasis on compulsive behavior, and the definition of addiction that I use is it's obsessive thinking and compulsive behavior that we persist in despite the negative consequences. And you certainly encountered that. You encountered it in your own life, and you encounter it in with the people you work with. So you are going to offer today the 3 A's, 3 simple steps, all starting with A, to help people work with compulsive sexual behavior. So I wonder if you'd be kind enough to walk us through that.
Sure. So basically, I call it the 3 A's, and because I deal with what I like to call is chronically problematic sexual behavior, the whole term sex addiction is it's outdated, and there's so much to this. Literally, the field is expanding at light speed. I mean, every day is they're coming out with new research. So, but the big thing is we live in an objectified culture. Unfortunately, advertising, uh, uh, unbridled capitalism has tapped into one of the most powerful drives we have, which is our sexual drive. Sex releases the most amount of dopamine of any other natural reward. So it taps into a very primitive system, and it can be very addictive. Um, so basically, objectification sells. Okay, um, and and I learned this from Patrick Carnes, who's one of my mentors, Dr. Pat Carnes, and I'll never forget him saying this. He said, when we objectify others, we really are objectifying ourselves, which is a form of self-abuse. And it was like he
Hmm.
threw a dart in my heart. And I was like, wow, that is really a pretty profound statement. And so part of the deal with me in my own recovery was learning that not to objectify myself and others, that I'm more than an object. I'm a soul spirit essence. And yeah, I have this human body, but I'm a lot more than that. So one of the things I like to teach my clients, I always get clients, patients, the human beings that I work with, is to help them get back in touch with their own humanity. So I call it the 3 A's. Alert. So the alert is basically, and we all have, Dr. Helen Fisher, who's probably is the world leading expert on love. She's an amazing woman. I profound respect for her, but she talks about, we have a lust circuit, we have a romance circuit, and we have a pair bonding circuit. The lust circuit is, I call it the zzz, and we know it when we feel it. I know it when I see it. It's like, whoa. And so that's the alert. Oop, there it is, right? And then I have to, and not to demonize that, but in early recovery, I have to learn to respect that lust circuit because it can overwhelm me. Okay. So the alert is, oop, there it is. The second A is the avert. Avert my gaze. Usually it's visual. I know for a lot of guys, it's visual.
Oh,
I have
yeah.
to avert my gaze, right? So I have to focus on something else. And then the last A is affirm. I affirm, hey, they're a child of spirit. There's someone's mom. There's some, and I say this, there's someone's daughter. There's someone's father. There's someone's son. And then I affirm myself. I'm a child. I'm a child of spirit. I'm worth more. I deserve more, right? Because I've been objectified before, and it's a horrible feeling. I don't want to be reduced to an object. So the last piece, that affirm, is really important because it says, it's a statement to myself that I'm worth it, and I'm going to live my worth. And and I tell my guys, this is kind of, I don't know, the movie The Full Monty. I say I don't want to cheat myself because I can get trapped in that lust circuit. And I say, I want the full Monty. I want to have the lust, I want to have the pair bonding, and I want to have the romance. And
Hmm.
man, when you have all that, it is awesome. And I don't want to cheat myself. So that alert, avert, affirm is really a powerful little tool I can do in the moment, especially in early recovery, because we are bred, I believe we're bred to objectify.
We
It's
are.
in the culture.
It's a survival thing, isn't it? Right? For men, especially, I think we're more visual, right? In order to procreate, and so the species continues, right?
Absolutely. And Helen Fisher, Dr. Fisher says that that sex instinct and our ability to want to mate, it's right there with thirst. It's in the
Hmm.
same part of the limbic system as
Hmm.
thirst. So that's how powerful the drive is
Yeah.
to for sex.
It's so interesting. We both work out at Gold's Gym, different locations, but I know you probably have the same experience I have. I was in there this morning. I'm over on the free weights, and this young lady walks in, and it's not bad. It's she has an orange jumpsuit on, and just, I mean, how can you not look, right? So now I'm in committed relationship with a woman I absolutely adore, and I'm not interested in getting involved with anyone. But I immediately, she caught my eye. And I remember what Picasso once said when someone talked about how he got involved with younger women. He says, I appreciate all things beautiful. So I can appreciate, here's a young woman who's really in shape and healthy, presumably, and just let it go. Right. And I avert my gaze. First of all, it's easy to be at my age to be viewed as a dirty old man, like, wow. So, but it's interesting in the Buddhist teachings, they have something similar called guarding the sense doors. In the book, guarding the sense doors, and the Buddha taught it to his monks because they were supposed to be celibate, right? So
Mm.
it's like, it's a similar kind of thing. It's like, you know what? She looks great. And I'm really glad, for her, she's, but I don't want to objectify her. She's so much more than a young woman who's in great shape. Your comments, because I know you run into the same thing, Eric.
Absolutely. I have to do the same thing, Eddie. What you just described, I have to do to this day. Um, and and it really is it's you practice this over and over, and you start. I'm at a point now where I can enjoy
Mm-hmm.
the beauty,
Sure.
and there's so much more.
Oh
There's
yeah.
so much. It's kind of like I tell my client, the guys. I mainly work with guys, but I tell them, do you want to live life in black and white or high definition IMAX surround sound? Do you want to have 50 billion colors on your palette, or do you want to have 10? The choice is yours. What do you want to live? How do you want to live? And it really is in an individual basis. And some people want to stay stuck in that lust circuit.
Hmm.
And who am I to judge that? I'm
Right.
not. I mean, that's I don't have. I just know for me, I want to go. I want to have 50 billion colors in my palette. I want to live life in high definition color. So the choice is really up to me. And I always point that back to my clients. How free do you want to be? What kind of life do you want to live? It's your
Hmm.
call.
So I'm curious, when you notice that maybe you're, alert, um, avert, but maybe you notice you're caught a little bit. Is there a phrase or anything that you say to yourself, or do you have a little ritual kind of thing that
I,
helps you affirm?
yes. I always remember that when I learned this in treatment, and my therapist, she's like, when you point, I want to blame others, right? But the three fingers pointing back, right? And we have that saying in 12 step, if I spot it, I got it.
Mm-hmm.
Well, I have to remind myself that these three back at me are affirming me, that it really starts with me, because intimacy is an inside. Into me I see. It's an inside job. It starts with me. And we're bred to believe it's out here. When I get the car, the woman, the shiny object, I'm going to be okay. And that's a setup for a world-class train wreck, as we know. It doesn't work that way,
Mm-hmm.
right? I better know my parts, learn how to love them, the shadow and gold, the needs and wants, how to differentiate the two, and how to ask for them. And then, or the tricky part is, am I worth letting them in once I
Mm-hmm.
get them? Because I may just get
Yeah.
what I asked for.
So you've offered three steps: avert, oh, I'm sorry, alert, avert, and affirm. This is something anybody can do, right? Pretty much.
Absolutely.
Yeah.
Absolutely.
And you can do it in any kind of setting. You can do it at the gym. You can do it at the post office, walking down the street, um, any kind of situation. Nobody has to know you're doing a practice. It's not like you're teaching them, well, I got to do this tapping thing, and you're in the DMV and you're going, I'm not doing that. you know, you can do it anywhere, and it only takes what, less than a minute?
Yeah.
Yeah,
Yeah.
that's
It's
awesome.
powerful.
That's
It's
powerful.
very powerful.
Yeah.
Yeah.
So I know you've worked with many individuals, and obviously confidentiality is, we don't even question that. I mean, do you have an example of someone who came with you and you've seen them really make a shift, that maybe a brief example of someone that,
Sure. Sure. I had a young man who, musician, uh, incredibly talented, good looking guy,
hmm,
suicidal. He couldn't stop, his multiple affairs. You can imagine a gregarious musician attracting,
oh,
people.
women love
Yeah, I
musicians,
mean,
unless they're a bass
throwing
player.
themselves right.
That's the joke.
And he's since he's married. He's getting engaged. He's in a
Hmm,
full. He was suicidal when I met him.
hmm,
He had called off the wedding, and his over 2 years of solid sobriety now. Um, I like to use that term well-briety. There's a
hmm,
difference between being abstinent and having emotional sobriety. He's really
hmm.
living a beautiful life, and I'm honored. And
Yeah.
he's engaged, and he uses that, and he's a shining example of,
Wow.
somebody who, it is I would say the sexual piece is different than drugs and alcohol, in that it is a process addiction, and it needs to be looked at a lot like an eating disorder, where the goal is not to give up food or sex. The goal is to develop a healthy relationship
Hmm,
with sexuality, whatever that means for each individual, which requires a lot of living your life in consultation. You got to have a world-class support network, and when in doubt, push pause and get reality checks. And that's a lot of work. And so a lot of people struggle with this addiction, and it is rampant
hmm.
because it sells. It's big money, and whenever you have big money, you have big shadow.
Yeah.
And so it's not going away. And so that's why I'm passionate about teaching young kids about the lust circuits, the prayer bonding, the romance, and
Hmm.
just getting the word out that people can and do recover from this thing. So
Wow.
that's an example of
Wow.
a story that he recovered. I mean, he's recovering.
Yeah. You packed so much into that. That was so great what you just said. And I would think for anybody watching this video that's struggling with this issue, that they would feel inspired. Uh, so how can people get a hold of you, Eric, if they want to work with you?
Sure. You can look me up on my website, heartandsoulrecovery.org. And that's my website. And all my contact information is on there. And I've done a couple of YouTube videos. You can probably find me about my story. I'm very out on this. I want people to know that we can and do recover, because there's so much misinformation about this. And I'm not sex negative. I'm sex positive. I love sex. It's about, hey, this thing can become addictive.
Hmm.
And just to know that that's part of the package. And so heartandsoulrecovery.org, or call me 828-337-0391. That's my direct line. And yeah, that's how you can
Yeah.
get me.
So if anybody just went reaching for a pencil, give them the number again.
Sure. 828-337-0391.
And I will mention on this video, in the content that goes along with it, I'm going to put information about the 3As. I'm going to put the contact information for Eric. So if you're driving your car, streaming YouTube, when you get home, you can take a look at it and contact Eric. And as I said earlier, if you have questions or comments, I'll make sure that Eric gets those and is able to respond to you. one way or the other. So, Eric Belsterling, thank you so much for joining me. And to those of you watching, thanks for watching. And everybody have a great day.
Thanks, Eddie.
Mm-hmm.